For several years, B. Yorker has been tracking the phenomenon of nurses who have killed their patients. The Georgia State University professor first became interested in the subject when a large number of critically ill patients experienced cardiac arrest and died at the Phoebe Putnam Hospital in Albany, Georgia in 1985. Terry Rachels, a nurse at the hospital, was arrested in the suspicious deaths of 12 patients. She was convicted of killing 4 people.
I think she had some feeling of not wanting to put patients through heroics or through prolonging their life unnecessarily.
Yorker says her study shows there are 3 main reasons why nurses kill. They do it for the excitement of trying to revive a patient as a mercy killing or to establish a need for an intensive care unit, for example. David Diaz, a male nurse in Los Angeles, was suspected in 1981 in the suspicious deaths of 27 people in 2 hospitals. Diaz was eventually convicted of killing 12 people.
They brought a lot of the patients' bodies, they exhumed them, pulled them up from the grave 2 years later, and looked for traces of lidocaine, which is a common heart drug that he used.
Diaz also worked the night shift, and that's a common element in Yorker's study. The nurses worked the 3 to 11 or 11 to 7 shift. They injected patients with hospital drugs. Yorker also points out that some of the killers had been abused as children. Janine Jones was suspected in the deaths of 20 children in Texas in the early 1980s. She was convicted of killing 12.
She seemed to be very enlivened by being in charge, by demonstrating her skills at cardiac resuscitation, driving in the ambulance on their way from the doctor's office to the hospital. She was barking orders and, begging the child to stay with her.
These are shocking cases, but there aren't too many, and Yorker says the killers can be stopped.
I think as long as we are really monitoring patient outcomes, really monitoring the use of medications, that it deters a person who might have a potential for this activity from acting it out.
New York nurse Richard Angelo, suspected of killing 7 patients, convicted of 4. Los Angeles nurse David Diaz, suspected of killing 27 patients, convicted of 12. Texas nurse Janine Jones, suspected in the deaths of 20 children, convicted of killing 1 of them.
The nurses seem to be somewhat compulsive when they do this. They repeat the behavior again and again until they get caught. They may want to get caught.
Georgia State University professor B. Yorker has researched the phenomenon of nurses who kill. She found that it is rare, but there are some common elements to these strange patterns of murder. Take, for example, David Diaz.
He was described by many people as being excited and enlivened by the code. He liked being in charge. Some people said he really wanted to be a doctor and that this was his way of acting out heroics and saving patients.
Child killer Janine Jones fit a similar pattern.
On their way from the doctor's office to the hospital, she was barking orders and, begging the child to stay with her and, really seemed to be enjoying the life-saving activity.
In addition to excitement, Yorker found 2 other motives for these killings. Mercy killing, the establishment of a need. For example, in 2 cases, nurses brought on cardiac arrests to show the need for intensive care units administrators wanted to close. Yorker says she became interested in these murder cases after hearing about the unexplained deaths in 1985 at Phoebe Putnam Hospital in Albany. Colleagues suspected Terry Rachels was terminating the lives of critically ill patients. She fit a pattern later identified by Yorker. Rachels worked at night. Death was by injection of medication commonly found in hospitals, and Yorker says, like many killers in her study, Rachels had been abused as a child.
She'd also watched her mother die on life support equipment, and I think she had some feeling of not wanting to put patients through heroics or through prolonging their life unnecessarily.
Rachels was suspected of killing 10 patients. She was found guilty but mentally ill. These cases are shocking but rare. Yorker says she has found only 12 documented cases of compulsive murder by nurses. Jim Kozierski, Channel 5 Eyewitness News.